Good morning, everyone. Welcome back to the Asia-Pacific Symposium. Today is day 2, and what I'm going to be presenting to everybody is the Asia-Pacific State of the Community the presentation. My name is Mui Van Zandt. I am a Senior Director at IQVIA, but I am not coming to you today as an IQVIan. I am coming to you as an OHDSI collaborator. I am one of the core members of the OHDSI APAC Steering Committee, who is the sponsor behind all of this, this particular symposium here. Today, what I am going to tell you a little bit is about the 6 different chapters that makes up the OHDSI Asia-Pacific core group. So you can see here, there is South Korea, China, Japan, Australia, Singapore, and Taiwan. These 6 chapters were formed throughout the different years here. And what I'm going to do today is give you a little bit of overview of who they are, what their history is, what some of their goals and accomplishments were this year, and what they're going to be looking for, what you can look forward to in 2021. Okay, we're going to start by going through the chapter that's been with us the longest, OHDSI Korea. OHDSI Korea was the first chapter in the Asia-Pacific region to join OHDSI itself. Its goal hasn't changed. It's to allow patients and clinicians and other decision makers around the world to use the OHDSI tools and evidence every day. They have over 100 different participants from the different academic, government, and industry areas. They have a governing board, which meets very frequently and in different locations. I remember 2 years ago when Professor Ray Park, who leads this chapter in Korea, went to China and talked at their symposium. He shared his experience with everyone there on how he was able to help OHDSI Korea move forward and be able to produce the amount of successful stories they had there. And one of the things that he mentioned, and it kind of embedded in my head, was the fact that he did a lot of convincing and a lot of talks to both clinicians as well as board of directors within different hospitals, and how he was able to constantly move these folks on why OHDSI is good, why it's important, and why communication amongst us was so important in order to move science forward. So it was very impressive what he did. I remember he said he's done more talks than most people would do, in a lifetime in like 1 year. And he had a chart about it. So quite impressive, great job, well done. A big kudos out there for Professor Park and what he has led over in the Korean chapter. Now, what have they done, right? These are just a few highlights of some of the things that they've done within the last 6 years. Of course, 2014, they first joined the OHDSI community. Professor Ray Park here that you see in the middle here, he, from Aju University, he showed the first public Achilles website at a face-to-face at the Columbia University in 2016. Then in 2017, they did their first OHDSI International Symposium, where they invited many different speakers from around the world, including Mark Time, Patrick, and Mark Shishard, which you guys heard from yesterday. In 2018, Professor Ray Park, working with the different government institutions, was able to launch the FeederNet project, which is a project that enables and wants to get a lot of the different EHR systems in Korea onto OMOP. This project was sponsored by both the Ministry of Health and the Ministry of Industry, and they released quite a few grants out there to help different organizations get into OMOP. In 2019, there was a datathon for 2 days where they ended up, I believe, doing almost 20 different, not publications, but 20 different studies, resulting in about 20 different studies that can lead to publications. And it was all in place, of course, before Corona. And then also in 2019, we did our first OHDSI Korean tutorial, which involved over 85 different participants at a hotel. The agenda was fully packed with different folks from Korea talking about their experience on what OMOP was able to bring to them, as well as having a miniature atlas session where folks were able to play with atlas and be able to do research questions. And of course, since Korea was the first chapter in OHDSI, they were also the first to translate the OHDSI book that they have into Korean. So if you want these are actually available. You probably saw one of these yesterday. Patrick, I think, had it in his background. But this is the Korean version of the OHDSI book that is readily available for you to purchase if you want to on the OHDSI website. And last year, they went and held another OHDSI International Symposium at a ski resort. It was quite interesting. We were at the ski resort for 2 days, I believe, locked up, and it was really beautiful, very nice, wonderful symposium. Got to meet a lot of great people then. This year, couldn't go anywhere, but you know, with this whole COVID-19 effort that pandemic that we have, South Korea stepped in as well once again. You heard Dr. Chan yesterday talking about the HERA program that they with the COVID-19 OHDSI study. You can see here South Korea decided to share the world's first de-identified COVID-19 patient, HERA, to international researchers and allowing them to do research. They have regular meetings and a regular briefing for HERA. They were talking about it and launched it, as well as the Korean community supported the COVID-19 OHDSI study-a-thon. And from there, as you heard from yesterday's COVID-19 discussion panels, there was a lot of research and a lot of good that came out of that. The other thing that we mentioned earlier was the entire feeder net program. You can see here, these are some of the Korean activities so far up to where we are now, all these different sources that are now in OMOP, over 40, you can see here 40 different hospitals and 59 million patients. So they are really on their way to get the entire Korea into the OMOP CDM model. Great job so far with, and great kudos to the Korean team. Now, what are their goals, given that they've done so much that you can see? Their goals for 2021 is to convert the national database into the OMOP CDM, as well as integrating between the hospital systems and the national claim systems. They also want to provide more educational courses, create better standardization across the different the Korean healthcare data owners, of course, conduct more OHDSI studies, as well as adding in the extension models that we have out there, such as oncology and genomics. Okay. Next, we're going to move over to China. China was established in 2016. Very similar. Their goal is to promote better healthcare in China through data science and informatics approaches. More specifically, they want to extend and customize OHDSI data science approaches. They want to enable big data investigations. Also, they want to promote international collaborations in both education and science. Okay, they have 6 different subgroups. You can see here what those subgroups are. They have over 500 different participants from the different industries. And here are some pictures of who some of the leaders are. Some of the activities that the Chinese team and the regional chapters have been working on, they spent a lot of their time doing a lot of symposiums and education. In 2017, we had our first China symposium in Hangzhou, which had over 200 different participants. Then we had our first hackathon in Shanghai, and this consisted of both folks from the Chinese collaborator and also the Korean collaborators, because they're so close. The Korean team actually, quite a few of the Korean folks came over for our first hackathon. And then in 2018, we had another symposium in Guangzhou, which had over 180 participants, where we also brought over some international guests and had them speak about their experience. We had a smaller tutorial in Zhejiang University in Hangzhou. And then we had another hackathon in Beijing. Then in 2019, we did several more hackathon study-a-thons as well as tutorials, the first one in Xi'an. Then we had the Symposium in Shanghai, a Fudan study-a-thon, where we actually did a PLE in that session. And we're still working on the paper here, but we're hoping that paper will be released soon. And then we had another tutorial in Guangzhou. And then this year, because again of COVID-19, we didn't get to do a lot of the face-to-faces, but that didn't stop many of the folks in China to push things along. So in May, we started the Book of Odyssey translation. The hard copy is now available, and we are working on making the printed version available on Amazon. Should be released sometimes early next year. The Chinese vocabulary, which was very important, we worked on getting all of that out. It was released fully in October into Athena, where you can now download it. In August, the NMPA released some guidelines about RWE and RWD. And in the August release, they actually mentioned both the EMA guidelines as well as the OMOP Odyssey organization and how we should probably look at those and when it comes to RWD. Right now, you guys have heard yesterday on one of the sessions, the teams are collaborating in this APAC hypertension study that's led by Professor Yue Lu. Also, we worked on the localization of Atlas, which is something both Korea and China worked on. This will be released probably sometimes next year. We had two other tutorials, one in person and one online. And if you look at the goals of 2021 for the China chapter, we want to bring on more data assets, right? We want to bring on more organizations into OMOP. It's very similar. We want to train folks. We want to do training of the trainers. One of the things we've learned as the Odyssey APAC community is that trainings seems to be a little bit easier if it was in their native language. So we're working on training. We will be working on training the trainers so that those trainers can speak in their native language. We also want to spend a little bit more time providing in-depth OMOP training, such as creating exercise books that will be a complement to the Book of Odyssey. Of course, again, want to contribute to more studies, both internationally and locally. Next, we move to Odyssey Japan. The Japanese chapter was actually formed a little over a year ago. And there are quite a few registered members already. Granted, we do have a small core group that's running everything, and you can visit their website here at OdysseyJapan.org. It's all in Japanese, so feel free to visit and learn what the Japanese region is doing. Okay, even though it was established in November, we actually had a lot of meetings before that to start talking about what Odyssey is and how to form this chapter. So you'll see here we had quite a few meetings. The first one actually was in June, where we had a miniature little introduction as well as a miniature little tutorial. Then we had the second one in September, and then the third one in November to actually do the little forming of the event. And then this year, at the beginning of the year before the COVID-19 pandemic, Danny from Oxford University was actually able to go to Japan and provide another in-person discussion with the group. They have monthly meetings that they do every month in the evenings, as well as they are also working on a book of translation. There's a Slack site that's set up, so if you have an interest, please contact Professor Haramatsu, who is the regional leader, to get in contact to help there. The Japanese chapter is also working on trying to establish a platform. One, recruiting collaborators, two, an ETL platform, and three, a vocabulary mapping platform. It's very important that we get these platforms up in place so that all the different organizations within Japan can get their CDMs into the OMOP model. Their goals for 2021 is to initiate a network of research. And within there, these are some of the sub-goals: being able to OMOP in the domestic data, providing feasibilities in terms of data existence, whether or not it's even possible to do research. Come up with research questions from the Japanese researchers, because just because your data is not in OMOP doesn't mean that you can't participate in research, right? And we've mentioned this quite a few times. Folks can come in and help us with the actual research. We are never lacking people who understand research. So it's great to get those questions and great to get them initiated by anyone, any of the regions, right? Trying to imagine what an OHDSI research network would look like. Participating in other network research to gain evidence, like right now, they are also participating in the APAC hypertension study, even though the Japanese community doesn't have data, but they are sitting in it to understand how a research can be done, starting a domestic preliminary research group, as well as expanding ultimately to the global research. Okay, next chapter we have Australia. Australia was formed in December of 2019, and these are the folks that are on the board of the Australian chapter, led by Nicole here in Australia. They had their first chapter meeting also in December of last year. They have 84 different members that are part of this core group, or part of this group right now. A few of their activities, some of the activities that they're going through, they have webinars whenever they have their monthly meetings. Where possible, they invite folks to come in and chat about different topics to get folks, to get everybody more familiar with OHDSI, more familiar with what the OHDSI Australia chapter is doing. As you can see here, these are some of the folks who spoke at their at the webinars. There is a bunch of OMOP conversions going on with both EMR and claims databases. As you can see here, some of the different EHR systems and hospital systems that are going up, as well as some of the claim systems that are being worked on. They are also a part of the regional and global research networks that are going on. One, the Australian community participated in the COVID-19 study-a-thon. They also participated in the Symposium, both the APAC version and the global version. They're in the hypertension study. They are doing International Public Data Linkage Network Conference. Also, they have multiple grants here to ensure that the quality of the data is being moved over to OMOP, which goes into one of their key goals in 2021. It's very focused on data quality and interoperability. So one of their keynote speakers at the Australian breakout session that you guys will be going to in a bit is Claire, as well as Michael Kahn. So Michael Kahn actually has a paper that talks about the Kahn framework. And if you guys are aware of the data quality dashboard, it is based on Michael Kahn's framework. And Claire here, who works for Janssen, is the lead of the OMOP CDM working group, as well as the lead of the data dashboard, data quality dashboard. Okay. They want to extend the OMOP CDM model to deal with data quality assessments. They want to map a lot of the Australian metadata and ontology from the national health systems, healthcare and welfare metadata standards onto the OMOP CDM. They want to promote the conversion of the different data assets to facilitate the participation of the network. And of course, they're actively participating in the community collaboration on phenotyping. Next chapter is the Singapore chapter. This one was established in 2020 at the beginning of the year. In November, as of November, they have over 30 different members from the different health institutions across the country. They meet every 2 months to discuss the different topics such as ETL, vocabulary mapping, and all that. Below here, you can see these are their founding members. Some of the stuff that they're doing to adapt the OMOP CDM to different projects that are going on, one from the National University Health Systems. They're mapping over all of their data into the OMOP CDM from the last, for 3 years, 2015 through 2020, and they've deployed the Atlas platform to enable the physicians to do research there. The second one is a combination of 3 different entities here. one involving the Health Science Authority, which is very similar to the FDA in the United States. They're mapping EHR data from 2011 to 2018 of 290,000 patients into the OMOP CDM, and it's the first Singapore integrated research data asset for chronic diseases that comprises of patient follow-up as well as EMR data, survey data, and other omics data. Okay. Recent activities that they've been participating in, one is the OHDSI Global Symposium here. They posted a few papers as well as participated in some of the tutorials. Silva, one of the founding members, actually helped with the OMOP CDM, one of the teachers actually at the OMOP CDM and standardized vocabulary. They participated in the European Symposium, participating in Research Network. They also participate, of course, in this Asia-Pacific Symposium. They're part of the APAC hypertension study as well as a core member of the planning committee. And they're also they participated in the EMEA conference here with 5 different sites on a poster that was submitted as well as accepted. Their goals next year, to create this national data sharing platform from the Ministry of Health. They're planning to build this data sharing platform that utilizes OMOP, and the Singapore chapter is actually one of the, is engaging as the technical advisors. And of course, they want to create a network research that allows for more collaboration amongst, not only within Singapore, but amongst the world. Last but not least, the Taiwan chapter. They were also formed this year. Their goal is to link all units of Taiwan and integrate with all the different OHDSI chapters that are out there, as well as the global region. Okay, and of course to do research across the all the universities and the hospitals in Taiwan. It was established in Taipei at the Taipei Medical University by Professor Jack Lee and Professor Usman, and also Professor Mark Hu. These are their founding board members, and Jason here is the Taiwan contact. If you guys have any interest in the Taiwanese chapter, please contact Jason. Some of the activities that they're doing in 2020, this revolves around the Taipei Medical University Clinical Research Database. What it is it's an integration of 3 different affiliate hospitals since 2015. They're checking out all of the data, the timelines, just to make sure all the data is available, as well as how to link them together. They participated in, if you really want to learn more about this, you can go to one of the posters that they've created, and all the posters are inside the general session of the Asia Pacific. The paper talks about what they're doing and what the activities that they're doing. They actually formed a OHDSI technical team to figure out how this can be done in Taiwan. Some of the participation in the global research one, again, they are also part of the hypertension study that was showcased yesterday. They're also part of the comparative effectiveness study. They want to participate in the comparative effectiveness study that Professor Ian Wong talked about yesterday as well. They asked Professor Wong to come in and give them a discussion and a talk about how they're doing that, as well as they have now actively participating in the APAC steering committee. And like I mentioned, they have a poster out there that you guys can visit. Their goals is actually to do joint research projects, educational courses, as well as guidelines and handbooks and journals. Okay. You can see all of these goals from all the different regional chapters. They actually come in to the bigger goal of the APAC community and the APAC steering committee, which is enabling the APAC community to better understand the OHDSI ecosystems in order to collaborate in more observational research. And 3 of the sub-goals under there are education programs across the different regions, OMOP conversions across the different regions, as well as collaborative research. With that is my simple introduction of all the different groups. If you really want to find out more, please join us at the regional breakouts that you can see here. They are going to start in 4 minutes. These are all the different regional agendas. And to get there, what you can do is inside your OHDSI teams. If you are inside OHDSI teams, you can see the Asia-Pacific Symposium here. All of these regional chapters, they have already kick-started. All you have to do is hit this little join button here inside the chapters, and you will be able to join all of their live sessions. So please go there, check them out. They're in their native languages, and feel free to join them. You can hop in and out, like I mentioned yesterday, of these different chapters and get to understand what all these different chapters are doing and hear from some of the leaders as well as some of their guest speakers that will be speaking. With that, I will end my session. Thank you. Hope you enjoy the breakout sessions that we have presented to you, and come back to us during the next live meeting to have some fun with the community. Thank you. Goodbye.